Welcome to the first video in this series of using the Now Health website. This will demonstrate how to get an instant quote and buy a plan online. You'll find the instant quote form at the top of any page, and getting a quote takes a few simple steps. First, tell us where you need to be covered, the start date, how many people to cover including yourself, and their dates of birth. If you need a quote for more than 7 people, just click on this link to bring up the form. Complete the details and we'll call you back to discuss it further. So let's go ahead and get an instant quote. All our plans provide worldwide cover excluding the US, but we need to know where you're going to be resident to calculate your premium. So first, select the country. The start date. This will let you get a quote up to 60 days in advance. Next, select the number of people to be covered including yourself, their dates of birth, and click Show me the price to get your quote. This takes you to the plan page where you can tailor the package. Throughout the process you'll see these small boxes with question marks. If you roll over any of them, you'll find additional information and help. We also need to know your name and email address to send you the quote. Add them here and click the Update Quote button. Scrolling down you'll see the WorldCare plan selected as our most basic one, Essential. There are 4 plan options to choose from: Essential, Advance, XL, and Apex. Each plan offers additional levels of cover. You can see the Essential plan quote here. By changing the WorldCare plan to XL, you'll see the premium cost is updated automatically. Further adjust the premium by selecting the range of excess you're happy to pay in the event of a claim. Choose this excess to suit your lifestyle. For example, if you're likely to use your plan often, then select a lower or nil excess. If you're looking to reduce your premium considerably, then select a higher excess. In addition to the excess, you'll see the optional benefits panel here. Selecting any one of these options will also change the cost of the plan. When you've finished, click on the Update Quote button. Scroll down the screen and you'll see the total quote for the premium has been updated again. Once you're happy with the premium, select the payment options to either annual, semi-annual, monthly or quarterly, and in what currency you'd like to pay. When finished, click the Update Quote button again to see the total premium and monthly payments displayed. Now the quote's been generated, we just need to create an account and email it to you. Unless you make any further changes to the plan options, this is the price you'll be charged. Now click on the Next Step button to create your account. Completing this section will create your secure online portfolio and progress your quote. Just complete the fields on this page with your first and family name, what you like to be called, your gender, your nationality, your occupation, where you live, your phone number, and how you'd like us to get in touch. If you want to receive SMS alerts, make sure to add your mobile number. The data protection statement at the bottom explains your responsibilities as well as ours and how we look after your information. Tell us where you heard about Now Health and if you'd like us to keep you updated from time to time. With this section complete, click the Next Step button to continue to the summary page. Your quote is now stored and login details for your account along with a copy of your quote have been emailed to you. Here we see a summary of your details, your cover, the plan and benefits and payment information. At the bottom of the page is a breakdown of the premium. At this point, if you'd like more time and want to come back later, your quote is stored and remains active for 30 days. To continue, click the Next button to get your cover active. Here, we need to ask you a few questions about your medical history. We operate a full medical underwriting approach, which means you're asked a detailed set of questions about each person applying for cover. Just complete the questions for each person you want to add to your plan. If you don't know all the answers straight away, you can always save your quote and come back later. Answering these questions will not affect the price quoted. Once you've completed this stage, click on the T's and C's link to display them. You must agree to the terms and conditions by checking this box before continuing to buy your plan. OK, now you're ready to buy. there are 3 payment options. To pay by cheque or bank transfer, click on the Request a Call Bank link and one of our direct sales team will call you back at a time that best suits you. Or go straight to the card payment checkout and pay by Visa, MasterCard or American Express to get covered straight away. Click on the Buy button to continue. If you added information during your application which would result in our service or underwriting team reviewing your application, the process pauses here while we do this. Don't worry, we're taking the time to review what you've told us and someone will contact you within 2 working days. We do this because something you've told us means that we might need an underwriter to review the answers to your medical questions, or one of our service team needs to check that we can cover you in the location you've chosen, or simply that we need to verify an answer you've given. If your application doesn't need to be referred, you can go ahead and make the purchase. Complete the payment details form on this page with your name, the card type and its number. Select the valid from and to dates. And finally, the 3 or 4-digit security number on the back of the card and click the Buy Plan button to complete the process. A confirmation email has been sent to you and you can also print a copy from the top of this page. To go straight to your account, click on the View Your Home Page button here and use the login details emailed to you earlier. Logging into and managing your account is covered in the next video in this series. That's all there is to it. You're now covered.